Welcome everyone to today's webinar on preparing for adulthood, a roadmap for the future, session 2. My name is Courtney Kerfoot from the Division of Specialized Care for Children, or DSCC for short. And this webinar is hosted by DSCC in partnership with the Illinois Lifespan Program through the ARC of Illinois. This is the second webinar in a two-part series and focuses on the transition to adulthood for youth with complex needs, ages 15 and above. We will pause about halfway through for questions, and then we'll also take questions at the end of the presentation. You can find the recording and the presentation slides in the Family Education Webinars area on DSCC's website. In this area, you can also find past recordings of other webinars on a variety of other topics, ranging from navigating insurance to other state waiver services. And lastly, this webinar is provided by Claire Cook, who is DSCC's Title V Transition Specialist, and Suzanne Aaron, the Outreach Specialist for Northern Illinois with the Illinois Lifespan Program. Thanks to everyone for joining us tonight on this important topic, and I will turn things over to Claire and Suzanne.
Thank you, Courtney. My name is Claire Cook. The Division of Specialized Care for Children, or DSCC, provides free care coordination for families of children and youth with special health care needs in Illinois. We continually build partnerships and develop best practices for youth with special health care needs and their families. We're also a diverse team of professionals from various healthcare and human service backgrounds. We use this expertise and knowledge to support families and connect them with the right services and resources. As DSCC's transition specialist, I have two main responsibilities. First, I support youth with special healthcare needs to transition smoothly into adult life. Second, I work with DSCC to provide transition-focused supports to our care coordination teams and outside providers.
Hi, everyone. I'm Suzanne Aaron, and for over 70 years, the ARC of Illinois has been advocating with people with disabilities, families, and community organizations to make Illinois a place where people with disabilities can live, work, learn, play, and love in communities across the state. We believe people with disabilities should be full participants in community life, and we offer families and individuals the information, resources, family support, and training needed to reach their goals. The Illinois Lifespan Program has been in existence since 2001, providing information and resources on advocacy, supports, and services to individuals with intellectual and developmental disabilities of all ages, their family members, and others statewide. So there are several programs under the umbrella of the ARC of Illinois. The Illinois Lifespan team staffs the ARC of Illinois' helpline, provides outreach in person and virtually to schools and agencies, educating them about benefits, programs, how to navigate the complex systems people with disabilities face, and how the ARC of Illinois helps. Many of the questions we receive are related to the transition to adulthood. Think of ILS as your family practitioner. We can answer most questions, and if we can't, we have specialized programs at the ARC of Illinois that we can refer you to, or we can refer you to the agency or program that does. The CRS-AD after my name, in case you were wondering, indicates the additional credential of Community Resource Specialist for Aging and Disability. Many ILS staff have earned this additional designation. In Part 1, Navigating Adult Systems, we will explore how educated parents become empowered parents. We'll learn about adult guardianship, health insurance, benefits, and program changes. Part 2, Evolving Family Roles, discusses how, as young people age, family dynamics naturally shift. We'll explore how this may look for parents and caregivers of youth with more complex support needs, and how their daily management needs impact creating meaningful days. We'll expand on the role of support circles and how to make decisions that support youth and caregivers' long-term well-being. And this session focuses on youth and young adults age 16 and older with complex needs. Here you can see how we will break down parts 1 and 2. Part 1 is navigating adult systems. In this section, we will discuss many of the big ticket items or decisions that need to be made as your child turns 18 years old and therefore legally becomes an adult. Some of the benefits your child received when they were under the age of 18 may have different eligibility rules for people 18 and above, or they just simply may be different for adults. Part 2 is evolving family roles. This section could be called the social emotional section of the presentation. Of course, there are many tasks to complete during these transition to adulthood years. At the same time, attention must be paid to the overall wellness of your young person as well as yourself. Emotions may come up as you plan for the near future and not so near future. As we age, we may face our own physical and emotional challenges. And at the end, we will discuss creating a plan and bringing it all together. We will now move into part 1, navigating adult systems. So this statement, educated parents become empowered parents, came to me back in 2018 when I was in a Partners in Policymaking session. Partners in Policymaking is an 8-month educational series that teaches parents of children and youth with intellectual and developmental disabilities, or IDD, and self-advocates about disability policies, best practices, and systems change. It occurred to me that the more I was learning and the more I knew, the more confident I felt in navigating this world on behalf of my son and with my son. I think it really resonates with what we want to give all of you with these 2 presentations: educated parents becoming empowered parents.
When your child turns 18, they're legally considered an adult. This means you may no longer have the same authority to make medical or other important decisions on their behalf, even if they still need your support. To continue being their advocate and help them access the care and services they need, you may need to consider options like obtaining legal guardianship through the court. Adult guardianship is when a court chooses someone to help take care of an adult who can't make important decisions on their own. This guardian can help with things like healthcare, money, or daily life. Guardianship allows you to continue making medical and other important decisions for your adult child, helping ensure they get the care and support they need. It extends the advocacy role you've had for years. The court process is meant to protect adults with significant needs, but it can feel overwhelming or frustrating. As a guardian, you'll take on new responsibilities, like following court rules and submitting paperwork. It's normal to feel sad or uncertain as others become involved in your child's care. These feelings are valid, and you're not alone in navigating this change. Depending on your family situation, you may need to ask others to take a bigger role in supporting your child. If your health or other concerns make it hard for you to be their guardian, another family member might be the best choice. In some cases, a legal guardian outside the family may be needed. Exploring guardianship includes looking at options like supported decision-making and financial planning. This future planning means deciding who will care for your child, where they will live, and their financial needs. It includes writing wills and setting up special needs trusts. Professionals decide if full guardianship is needed by checking if the adult can recognize decisions, consider options, understand consequences, and express their needs. This is reviewed regularly by doctors and other experts. This slide shows the questions you should try to answer at the time your child turns 16, up to the point where you're ready to file guardianship paperwork with the court. We'll answer all of these in the following slides. Our first question is, if guardianship is needed, what choices do I have? The Illinois Probate Act gives the court the flexibility to tailor guardianship to meet the needs and capabilities of people with disabilities. Depending on the decision-making capacity of the person with a disability, the court can appoint types of guardianship tailored to that person. In Illinois, there's two basic types of guardianship. Those are of the person and of the estate. A guardian of a person is in charge of making personal and healthcare decisions for someone who cannot do so on their own. The guardian helps with things like medical care, living arrangements, education, and daily needs. A guardian of the estate helps with things like the person's money, property, and finances. They ensure bills are paid and assets are protected. Sometimes the same person can be both types of guardian, but in other cases, different people may take on those roles separately. The court decides what kind of guardian a person needs. This can be either a limited or plenary guardian. A limited can only make certain decisions about the person's care or money as chosen by the court. And plenary can make almost all decisions about the person's care and money. This is the strictest type of guardianship.
To appoint a guardian, a petition must be filed in court. The petition includes basic information like the person's name, birth date, and address. A doctor's report must also be filed. This report describes the person's physical and mental abilities and includes evaluations to help the judge decide what type of guardianship is needed. A guardianship hearing is scheduled within 30 days after the petition is filed in court. The person who may need a guardian, called the respondent, must receive a summons and a copy of the petition so that they know about the case. When needed, the court will choose a guardian ad litem, or GAL, as you'll see there, who can be a lawyer or a trained volunteer. The guardian ad litem's job is to be the eyes and ears of the court and make sure decisions are made in the respondent's best interest. The second question is, can I afford to pay for filing and a lawyer? If not, do I know who to ask for help? It is important to understand the possible costs associated with obtaining guardianship. There are filing fees, and this is the cost to submit the guardianship petition to the court. There are sheriff's fees. This is the cost for the sheriff to deliver court papers to the respondent. And there are attorney's fees, and these are costs if you hire a lawyer to help with the case. For help navigating this, you can contact your local circuit clerk or Illinois Court Help. You can call or text 833-411-1121 or visit www.ilcourthelp.gov/HC/EN-US to find out the rules in your county. Each county may have similar steps for getting guardianship, but the requirements are not always the same. Now, for help with costs, there is a fee waiver for civil cases. Illinois Legal Aid Online provides a guided interview called an Easy Form that will help you fill out the fee waiver form to file with the court. Through the Illinois Legal Aid Online, families may qualify for free or reduced fee legal help. And the Special Needs Alliance also offers a special needs lawyer search. These lawyers are experts in the laws that cover disability, special needs, and elder law. If you are filing without a lawyer, and this is called pro se, There are resources to assist you. Illinois Legal Aid Online has a guide, How to Start a Case for Guardianship of an Adult. The link is available in the slide. The Illinois Guardianship and Advocacy Commission, they've got a phone number. Call 1-866-274-8023 for help. And some courts have self-help desks where you can ask questions, file paperwork, and find guardianship resources. And I just had to look this up for another family. So you literally just in your search engine, you type self-help, legal self-help for your county, and it should pop up. Guardianship cases are usually handled by circuit or probate courts. And again, these are done county by county. Is there a doctor that you can trust who can complete the physician's report? Talk to your child's doctor about guardianship. This letter provides medical evidence to the court about the individual's condition and their ability to manage personal and financial affairs. It ensures that guardianship is in the best interest of the individual while also protecting their rights. Here are some tips. You will need to make an appointment with the doctor. The doctor must sign the letter within 3 months of your court date. So try to schedule the appointment as close as possible to when you are ready to file with the court. Guardianship hearings are set within 30 days of a petition being filed with the court. And if a lawyer is helping you with guardianship, they can tell you when to make the appointment. What happens if I can't care for my adult child anymore? If you can no longer be your child's guardian, there are a few options. A successor guardian can be appointed if you can no longer be your child's guardian. This happens if you pass away, become unable to serve due to a disability, or if you need to resign. The court will choose a new guardian to continue providing care and support if guardianship is still needed. Testamentary guardianship is when a parent names a guardian in their will to take over after they pass away. The court must still approve this person and can choose someone else if they are not suitable. A guardian for an adult with disabilities must be at least 18 years old, mentally sound, not convicted of a serious crime, and approved by the court. They must show they can actively and responsibly handle guardianship. A public or private agency can be a guardian if the court finds it capable, but agencies providing housing to the person cannot be guardians to avoid conflicts of interest. A bank can be a guardian of the estate or the finances, but not of the person. And please note, this is not legal advice. It is best to talk with an attorney to find the right options for your family. There are other ways to support adults while still protecting them. If someone cannot make decisions at all, meaning they can't express their needs, understand consequences, or weigh options, guardianship may be the best choice. But needing help to understand information doesn't mean a person needs a guardian. Many tools and supports can help individuals make their own choices with some guidance. Young adults with intellectual and developmental disabilities have access to resources that support decision-making. These tools help them understand their options, ask questions, and communicate their choices. The Supported Decision-Making Arrangement Act offers a less restrictive option than guardianship. It recognizes that all adults can make their own decisions unless a court decides otherwise. With supported decision-making, individuals choose a trusted supporter, like family, friend, or professional, to help them understand and communicate their choices. This allows them to stay in control of their decisions with the right support. Other options include powers of attorney for healthcare and property. These allow young adults to share their wishes without giving up control. You can give someone certain powers now instead of waiting until you can't decide for yourself. And they can access medical records, talk to doctors, and ensure loved ones are included in decisions. This slide has helpful resources to learn more about your options. For expert guidance, the Special Needs Alliance offers a special needs lawyer search. These lawyers are experts in the laws that cover disability, special needs, and estate or financial planning. Other ways you can find help include searching for lawyers who specialize in estate planning and elder law, as they often handle special needs trusts and financial planning for people with disabilities. You can also contact the Illinois State Bar Association or your local bar association for referrals. They can recommend attorneys with experience in special needs planning. Now, this brings us to the end of the guardianship and adult decision-making sections. We can take questions for a few minutes if anyone would like to put them in the chat or raise your hand to unmute. Do guardians need to carry the letter of guardianship all the time? That's a great question. I know I have a copy of it in my car with me. I also have a copy of it in my phone so that it's available to me at any time. So physically carrying it, maybe if you have it, I would say if you have it in your car, if you've got it electronically, it would be helpful to have that, yes. But this is also filed with your county court, so it could also be accessed there. Can there be more than one guardian? Yes, there can be co-guardians. And I would say that in speaking with a judge once, they don't prefer to do co-guardians. They will do it. But what I was told is that sometimes that they just kind of learned that sometimes when you've got co-guardians and people don't agree about things, it can make things complicated. Or if both parents are co-guardians and then there's a divorce, then it gets kind of sticky. So the answer is yes, you can have co-guardians. Sometimes the judges prefer for just one, but the answer is yes, you can. Okay. What if the guardianship is not granted? Can you go back through the court and try to obtain it at a later time again? That's a really good question. I know that sometimes guardianship can be contested, and then I guess I'd say that if you went through it and tried to do it on your own and it wasn't granted, you might need an attorney at that point and use our resources that are in the PowerPoint here. I think you probably could try it again, but it might be helpful to know why it was rejected in the first place. So that you can either address that the next time you go through. But yeah, I don't know, Claire, if you have anything to add to that.
I don't have anything else to add, no. I think
Okay.
you covered it.
Okay, great. All right. I think we've come to a pause here. So let's go on. Thanks, everybody, for your good questions. We're going to go on to the next section of adult insurance benefits and program changes, and Claire can take it away.
Thank you, Suzanne.
Mm-hmm.
Next, we'll be giving brief descriptions and facts about adult insurance, Medicaid, Medicare, the differences between SSI and SSDI, and programs for long-term care. If you have any questions, please continue to add them to the Q&A. Be sure to visit our website for fact sheets, webinar recordings, and PowerPoints from our benefits management team's family education webinar series. This benefits team within DSCC is dedicated to helping families navigate through the complexities of insurance. And that link is on that page as well. Keeping health insurance as an adult is important, but coverage may change as your child transitions from childhood to adulthood. The eligibility requirements for benefits might be different, and you may have new coverage options to consider. Understanding your insurance benefits is key to using them. For private insurance, children can stay on their parents' private insurance plan until age 26. For an adult on their parents' military insurance, they are allowed to remain on the plan until they're 30. It's key to note that most private insurance plans will allow for a disabled child to remain on their parents' plan after the age of 26. The insurance company will most likely require some medical documentation and possibly a letter from a physician confirming that the child is disabled. Different insurances and employers have different criteria, so you must check with that plan for specifics. If you have no coverage options, you can purchase insurance through the federal marketplace at getcovered.illinois.gov. You can also have both private insurance and Medicaid, either as a child or as an adult. The picture on this slide is of DSCC's private health insurance chart. You are provided with a copy of this as a part of our resources now and also after the webinar. All Kids Assist is Medicaid coverage for children in Illinois. That coverage ends the last day of the month when a child turns 19. After that, young adults are considered for other Medicaid programs for adults. The Department of Human Services will determine the best program for that young adult. Illinois offers several adult Medicaid programs, including the most common being ACA Adult Medicaid, Aid to the Aged, Blind, and Disabled, or AABD, and DCFS, which is often extended to age 21, as well as family care. This isn't a complete list of all Medicaid programs that are available. It's also recommended to apply for adult Medicaid benefits 1 to 2 months before you turn 19. This gives the Illinois Department of Human Services enough time to review the application and decide. By law, Medicaid must process applications within 45 days of receiving them. The picture on this slide is of DSCC's Illinois Medicaid Programs and Eligibility Guide. We also have a copy of this provided. Medicare is a federal health insurance program that you don't apply for in the usual way. It's something you become eligible for once you meet certain requirements. Young adults with disabilities may qualify for Medicare if they have a disability that meets the Social Security Administration's guidelines. These are specific conditions that Social Security has decided make someone eligible for disability benefits. Before Medicare coverage can begin, that person must receive Social Security Disability Insurance, or SSDI, for 24 months. This can also apply to some dependents if their caregiver is getting Social Security Disability Insurance. If you want to see which disabilities qualify, you can visit the Social Security website. We also have this Medicare fact sheet that is available on our website and included in the materials. The differences between Supplemental Security Income, SSI, and Social Security Disability Insurance, SSDI, can be confusing. Supplemental Security Income can help pay for your food, clothing, and housing needs. This is a financial benefit based on financial need. It's not a medical benefit, and it doesn't mean that you qualify for Medicaid in Illinois. After turning 18, Supplemental Security Income eligibility is based on the disability rules for adults. Individuals that are receiving it before 18 go through a redetermination for adult SSI at the age of 18. To be eligible, you must be a U.S. citizen or qualifying non-citizen, be disabled as defined by the Social Security Administration, and meet income and asset limits. Now, Social Security Disability Insurance, or SSDI, is a program that provides insurance payments to people who are no longer able to work because of a significant disability. It's based on earnings and payroll taxes. To be eligible, you must be disabled by the adult definition as defined by the Social Security Administration and have worked and paid into Social Security through taxes, or be the disabled child, disabled before age 22, or disabled spouse of an individual who currently receives Social Security disability insurance, or an individual who was receiving it at the time of death. It's important to note that after receiving it for 2 years, you can receive Medicare. At some point, your adult child may need to move into an intermediate care facility called an ICF, or a community integrated living arrangement called a CILA. We'll talk more about what these look like in the following slides. But before someone can move into either one of these facilities, they need to go through a pre-admission screening. This is a federal requirement to help ensure that individuals are not inappropriately placed in nursing homes for long-term care. The screening checks if they qualify and looks at other options in the community. The first point of contact for this process is through the Division of Developmental Disabilities, which is the main agency that helps with long-term placement services. The Division of Developmental Disabilities works with Independent Service Coordination Agencies, or ISCs, which are community groups that complete the screening. Families should contact their local Independent Service Coordination Agency, or ISC, to start the process and find the best care options for their adult child. To locate your ISC agency, you can go to the DHS website on this slide, then select your county to find the one that's nearest to you. Note that this screening is separate from the PUNS list. PUNS list is for those that need services in their homes and communities. You can also locate facilities licensed by the state by clicking on the Illinois Department of Public Health's Office of Healthcare Regulation portal link that's in the copy of the slides.
Okay, so heads up, this slide will include lots of terminology and acronyms. The Home and Community-Based Medicaid Waiver for Adults with IDD is administered by the Illinois DHS Division of Developmental Disabilities. There are 2 main programs for adults with IDD, or intellectual and developmental disabilities, who need a place to live. The first is a home and community-based waiver program, and the other is an intermediate care facilities for adults with IDD, otherwise known as an ICF-DD. Families can also choose to pay privately for housing, but please note this is not an option financially for most families. If an adult qualifies for waiver funding through the Division of Developmental Disabilities HCBS, or Home and Community-Based Services waiver, they have different living options in the community, such as group homes, which are called CILAs, or Community Integrated Living Arrangements in Illinois. There are community living facilities, or CLFs. There aren't a lot of these, but they do exist. Host homes, or family or part-time support, and these are called intermittent or family CILAs. And again, CILA is Community Integrated Living Arrangement. Medicaid pays for services received in an ICF-DD. Most are large group settings of 9 or more individuals with IDD, and there is no need to be on the PUNS list to access these. An ICF-DD is a residential facility where most residents have intellectual or developmental disabilities. These facilities are licensed to provide specialized care, health services, and training to help residents gain skills and live as independently as possible. They are not for people who can live with little supervision. So in general, these are for people with higher support needs. So now we have reached the end of another section. Are there any questions? I'll open up the chat here. Here's a question about, can a person with a disability obtain a driver's license if they are under guardianship? I know we passed the slides about guardianship, thanks. I know there's... Claire, do you know the yes or no answer to this one?
Hold on, just
I think
if they are under guardianship.
I think the answer might be no.
Okay, yeah.
I'm not entirely, I know there is a definitive yes or no. I guess my question would be that if a person requires guardianship, which would indicate that they need assistance making decisions, judgment calls, they can't manage their own finances, can't make medical educational decisions for themselves. I guess my question would be, if all of that is true, then do we want to give them a driver's license and put them behind the wheel? I guess I'm not sure. Somebody's saying it depends on the type, maybe a driver's license. Okay. So that is my understanding, but we can get a yes or no answer for you on that. And for that, sure. The next question, if under guardianship, can a person vote? Yes. In Illinois, they absolutely can. That is one thing that is true in Illinois. If an individual is under guardianship, they can vote. Okay. All right. And this one might be for Claire, but is the process to qualify for an ICFDD or an MCDD the same as PUNS? That is proof of disability originated before 18 and IQ is below 70.
I am not for sure on that one. That's something I can definitely look for answers on and then get back with that.
Okay. Okay, great. These are great questions, and we can get back to you about them. Absolutely. Someone has said, if the guardianship is the financial only guardianship of the estate, therefore, they can go for a driver's license just like anyone else. Okay, and that makes sense. That makes sense. If you're just needing help with your finances and somebody only has guardianship of your estate over you, then that would make sense that you would be able to get a driver's license like anyone else. Can we have a list of acronyms explained?
Yes.
Oh boy. I believe you all have one. I know we've got one too. But yeah, there's a whole world of acronyms, aren't there? And in fact, do an entire presentation on acronyms and who does what. So yes. Claire, does DSCC have a list of acronyms?
We don't, but this is definitely something in the follow-up of webinar, we can send everyone out answers to the questions, and then we can send that also.
Okay, great. And I think we've got one through the Liggis Family Advocate Program. Here we've got someone commenting, typically the medical guardian must consent for a person to obtain a driver's license, and there are services available not covered by insurance where a medical evaluation can be done to determine the safety of allowing someone to drive. Okay, so it sounds like there are ways that if someone has guardianship over you, that you can still get a driver's license. It sounds like consent of the guardian is needed. All right, great questions. All right, so we can go on to the next slide now, part 2, evolving family roles. As young people grow up, family roles and routines naturally change. But what does this look like for young adults with complex needs? To explore this, we'll follow Sam's story over the next few slides. Sam is 22 years old and enjoys watching soccer and spending time with her cat, Mimi. She has quadriplegia and communicates using a switch for yes or no answers. She also shares how she's feeling with her parents and nurse through facial expressions like squinting, smiling, and kicking. Sam recently finished her school's special education program, and her family is now figuring out how to create a meaningful daily activity for both Sam and themselves as she gets older. In addition to discussing Sam's story, we'll break down the many facets of supporting you and your young adults' emotional and physical well-being. Having a plan can bring clarity and peace of mind when trying to navigate an uncertain future. It is not unusual for caregivers to experience feelings of helplessness, guilt, or isolation when thinking of the future. We bring you this section of the presentation in the hopes that hearing about one person's story, how a schedule was built, what supports the family created, and how each parent found the help they needed will show how making a plan can alleviate some of the fear and uncertainty. Planning a meaningful day with your child can be a mix of routine, engagement, and joy. Here are some ideas from Sam to make the day special while considering Sam's needs and interests. She loves petting Mimi and watching soccer on TV. Sam also enjoys moving around and swinging outside. She likes cuddling with her mom and dad under warm blankets. Sam also likes choosing her clothes and deciding if she wants to do certain activities. Think about what your child enjoys, whether it's music, movement, social interaction, or sensory experiences. Tailoring activities to their likes makes their day more fulfilling. Even if it's a special day, keeping some familiar routines like meals, rest times, or favorite activities can make it more enjoyable. Engage the senses. Here are some ideas. For music and sounds, play their favorite songs. Try an interactive music session or use calming nature sounds. Touch and textures. You can incorporate soft blankets, water play, sensory toys, or even a hand massage. Visuals and colors. Go outside to watch birds, visit a park, or enjoy colorful lights and projections. You can plan activities like finger painting or stickers. Think about something you like to do too. Maybe you enjoy the feeling of kinetic sand or squishing soft stress balls. You can make a sensory box with things that work for you and have fun playing with it too. The Illinois Assistive Technology Program, MAKERS program, creates assistive technology devices by using 3D printing, pressure forming, laser cutting, and other easy-to-find materials and tools. With things like special game controllers, Braille bingo cards, button pushers, prosthetics for arms, and writing aids, the possibilities are endless. For social interaction, consider getting involved in a community program or with special recreation through your park district or other classes. Try something outdoors if possible for a change of scenery. Focus on connection, not productivity. A meaningful day doesn't have to be full of tasks. It's about being present. I recently heard the phrase, "We are human beings, not human doers." Holding hands, sharing a laugh, or just spending quiet time together can be the most valuable part of the day. So, here is Sam's schedule. Sam's mom and dad planned activities they all enjoyed, aiming to spend at least 20 minutes a day together. They created a picture chart with Sam's favorite activities and included some they liked too. They also gave Sam some independence, like starting her own G-tube feeds. and set aside time for mom and dad to attend their church's parent group, or this could be a choir practice or a movie. They've built in time for something that brings their own lives joy and purpose. During the times when Sam is choosing an activity, these choices include her preferred activities we mentioned previously, like watching soccer on TV and petting the cat, swinging outside, all the activities identified as her preferences. Sam's schedule balances her interests with time for her parents' activities, sometimes including things everyone enjoys together.
Studies show that parents and caregivers of youth with disabilities face serious emotional challenges. Many experience feelings of sadness, hopelessness, anxiety, and stress, leading to frustration and anger. Caregiving can also cause trouble with focus and memory due to constant worry. Parents often feel stress about their child's future and their own. Caring for a child with complex health needs can take a real toll on your body and mind. Many parents experience physical pain, especially in their muscles, joints, and back, from lifting and moving their child. Headaches, fatigue, and health conditions like high blood pressure, migraines, and diabetes are common. The physical demands of caregiving, combined with emotional stress, can leave parents feeling deeply exhausted. This fatigue often makes it hard to manage daily tasks or get quality of sleep. Many caregivers also struggle with insomnia or disrupted rest. Mental health is so important, but seeking help isn't always easy. Feelings of grief, fear of judgment, and social stigma can make it hard to reach out. Many parents feel isolated, especially when caregiving responsibilities, financial strain, or lack of support make it difficult to stay connected with others or access care. We're sharing this to affirm your experience. If you're feeling this way, you're not alone. Your challenges are real and your well-being matters. Support's available and you deserve it. When planning for the future feels like too much, sometimes the best next step is connecting with others who've been there, seeking expert advice, or simply giving yourself a moment to recharge. One way to find support is by building your personal board of directors, as we discussed in our last webinar. What's a personal board of directors? In business, a board of directors is a team of experts who guide important decisions. But instead of helping a company, your board helps you. These are trusted people in your life who offer advice, encouragement, and guidance when you need it. Your board can include a doctor who understands your child's health needs, a friend who's been there for you through thick and thin, a business professional who helps with planning, a faith leader who offers encouragement, or your care coordinator or caseworker who can provide you with the resources you need. Sam's board of directors includes her primary care doctor, mom's church friend Evelyn, her cousin Sylvia, Grandpa Ray, and of course the people that help plan for her future, like her special needs law lawyer, mom's support from the ARC's Lifespan program, and her care coordinator, who all offer her different types of support. Building a strong support network is like creating a personal treasure chest of guidance, encouragement, and care. When you surround yourself with trusted friends, family, mentors, or community members, you're not just preparing for the future, you're making sure you have the support you need every step of the way. It can be difficult to think of how we can support our own quality of life and manage our own health challenges. What may not matter now may matter in a few years. Have you thought about what you want your life to look like in 5, 10, or 20 years? What experiences do you want for yourself and for your family? Who do you trust to care for your child when you can no longer do so? How will you know when that time comes and what will determine that decision? Take a moment to picture your future. What does life look like for you and your family? In considering your own well-being, you're thinking of your child's future also. Continuing our example of Sam's story, Sam's dad, Phil, is struggling with increased pain when he's lifting her. He has difficulty with household chores due to multiple sclerosis. His doctor recommends using a walker and warns that lifting Sam could worsen his condition. He can no longer drive. Sam's mom is also struggling but doesn't know where to turn for help. Their caseworker from Independent Futures suggests applying for the Division of Rehabilitation Services Home Services Program, which provides personal assistant services. Personal assistants are chosen by the individual to assist with various tasks, including personal care, household chores, and certain health-related procedures with the doctor's permission. This supports individuals under 60 with severe disabilities who need assistance with daily living activities at home. It can also provide things like home health nursing, assistive equipment, and environmental modifications. To refer yourself or someone else, you can click on Complete a Web Referral that's in the slides. Those that are over the age of 60 should contact the Illinois Department on Aging's Community Care Program by following the last link on the slide.
After thinking about what she wanted the future to look like, Sam's mom, Abby, decided she wanted to feel and be empowered to do the things she knew were best, not only for Sam, but for herself as well. This was a turning point for her. Up until this point, she felt like she had been living in survival mode. But now that Sam's health status had been more stable the last few years, she was ready to move forward. In our last webinar, we talked about the Caregiver Continuum Framework, created by Erica Stearns and Alyssa Newtile of Caffeinated Caregivers. They mapped the ability of caregivers to handle things over time. You can think of it in terms of your energy and ability to deal with things going up and down. The Caregiver Continuum is a way to show the different stages of caregiving from the first diagnosis to becoming a strong advocate. In the self-advocacy and resilience stage, caregivers begin to see their own self-care as a must. They use boundaries and seek support networks. This means having a stable support system that validates their well-being so that when they are ready to move on to bigger roles, they are taken care of too. Bigger roles might be through engaging with the community, either in peer support groups, through the sharing of resources, or by raising public awareness about disability and caregiving issues. Advocacy becomes collaborative. Caregivers support not only their own families, but also their communities, working to build stronger networks for caregivers and promoting awareness of systemic challenges faced by families of children with disabilities. As you can see through Sam's family example, it's important for parents and caregivers to create their own plans for the future too. By doing so, you are making sure both you and your child get the support you deserve. Future planning for your child is important to make sure they have the care and support they need throughout their life. There are several areas to think about when creating a plan for your child. We'll go into most of these in the following slides. They are financial planning, naming a testamentary guardian, writing a letter of intent, and making an emergency and backup plans. Having emergency and backup plans is just as important as the others. This means preparing ahead in case you can't care for your child due to a health issue, surgery, or other unexpected situations. Your child may need help with daily living, medical care, or special services as an adult. Financial planning helps cover these costs and ensures they have a safe and stable future, even when you can no longer provide for them. The ARC's Center for Future Planning provides a series of videos to help individuals save money and protect public benefits. Topics include ABLE accounts and special needs trusts. Illinois ABLE accounts, Achieving a Better Life Experience, make it possible for people with disabilities and their families to save and invest for expenses related to living with a disability without losing access to federal means-tested benefits such as SSI, SSDI, and Medicaid. Life insurance helps families cover living costs and future goals like education and retirement. But did you know that for families of children with disabilities, it can help ensure your child's care after you are gone? The Pacer Center's Financial Planning for Parents of Children with Disabilities website discusses using your life and disability insurance to ensure your child's care after you are gone. Please note that it is vital to work with a financial planner that understands the need to protect your child's government benefits and can guide you on making certain that the beneficiary language is written with this in mind. The Academy of Special Needs Planners is a group of special needs planning professionals such as lawyers, financial planners, and trust officers. Their website offers helpful information and connects you with professionals who specialize in planning for people with disabilities. Special needs planning experts can help with benefits like Social Security, Medicaid, school support, and veterans aid. Having more than $2,000 in assets, or $1,500 in some states, can affect Medicaid and other services. A special needs trust protects benefits while ensuring needed support. Reviewing your estate plan helps secure your loved one's future without risking their benefits. Writing down your goals and wishes for your child's future after you are gone is called a letter of intent. It is a way to share important information about your child with the person who will be taking care of them. It outlines your child's needs, history, routines, and future wishes to guide caregivers after you're gone. Though not a legal document, it ensures continued care and support. For an adult child with complex health needs, it's important to include details about their medical care and daily management. As a parent or caregiver, you understand your child's diagnoses and needs better than anyone. Others may not realize the full extent of their care requirements. When writing the health and healthcare section of your letter, consider the questions on this slide. Clearly outlining potential health complications and their impact could be life-saving. It's also crucial to identify who will take charge of managing your child's health care. These conversations can be difficult, but they are necessary. The people you choose to support your child in your absence need to be aware of what that responsibility involves before the time comes. Planning ahead ensures your child continues to receive the care they need no matter what. It also might help you sleep a little better at night.
Daily living topics in the letter of intent include questions about where you'd like your child to live, their daily support needs, and how they'll get from one place to another, and making sure they know what your child enjoys.
You can write your letter of intent however feels right to you, like a letter to a friend or a list of notes. Sam's parents found it helpful to use bullet points and included a short message at the end with their final wishes for Sam. While creating the plan, think about someone would need to know in the first few days of caring for your child. Make sure to update the letter when things changed. Sam's parents also wanted to make sure she could stay active in her community and keep as much independence as possible with a little help. They pointed out where to find important details, like her medication list and daily schedule, so nothing important would be missed. The most important thing for Sam's parents was making sure she knew how much they loved her and how proud they were of her. They wanted her to keep making choices about her life and how she lives. They also wanted her to stay connected to the people she cares about. We can pause for some more questions now, if there are any. Let me pull these up here. When I become my son's guardian when he turns 18, and I am now his PSW, is the income I receive to care for him taxable if he is living in my home? Ooh, tax questions. Okay. The official word is you need to check with your tax advisor because every situation is different. I'm reading this again. We can send you, there is a tax code, a tax policy that says that paid parent caregivers that are receiving these Medicaid waivers, that income is not taxable. I'll send you that link. I'll send it to Claire and then that can be included with those. But again, overall, find a tax advisor that knows what they're doing and consult with them for sure. Another person says, I can relate to Sam's mom in some aspects, overall health issues. I'm glad that these stories are resonating because you are not alone in this. We're raising our fabulous young adults and we have health and emotional needs as well. So great. Okay, we've answered that one. Okay. Here's the $1 million question. Where and how can we find a tax accountant that knows how to do these type of taxes? That's a great question. That is a really great question. And I would say use your social networks, check with fellow parents that have children in similar situations. It's networking. We, of course, can't refer to specific tax consultants. We can't do that, but I will say it's not easy. I'm sorry to say that. It's not easy, but check with your own networks. If you've got an attorney, they may know who can help with that. I know sometimes just even, well, I guess I'm just going to say use your networks and as much as you can. The school district may be able to, that you're working with, may be able to direct you to other parents that know about this. It's going to be a lot of word of mouth. I say this from personal experience, having tried to do an online search, trying to find people. I wish I had, boy, there's a list of people who know how to do this. I haven't come across it yet. So use those networks. And man, if anybody knows of a list, send it our way.
So we've talked about a lot today. We don't expect you to remember all of it. So here's a quick recap of what we talked about. And copies of all of our slides are available on the DSCC website under the Resources tab and Family Education Webinars. And it's also been in the chat. We began with Suzanne's creation of the phrase, educated parents become empowered parents. This led us into discussion of how to navigate the difficulties of being your child's guardian in Illinois, as well as information on alternatives to guardianship. We then took a deeper dive into understanding adult insurance, benefits, and planning for things like long-term care. Part 2 brought us to evolving family roles and introduced us to Sam and her family. Sam's family taught us how to plan for meaningful days, what it meant to deal with our feelings around future planning, and how to support not just our child, but our own quality of life. Finally, we talked about writing down a plan for the future that took into account everything we learned so far. And here is our contact information. We will answer all of those questions and send that in a follow-up email, excuse me.
Absolutely. Thank you for joining us today. Thanks for all the great questions. I see some other questions coming in, so I'll check in those. And we hope the information in this presentation was helpful and that you can take action on some of these suggestions to help you feel more empowered. Thanks for participating and asking some great questions. the questions that we got that we couldn't answer, we will get to you. We will, I'll also send that the IRS form about paid caregiving for that. But again, consult with the tax advisor on that. But thank you all. Thank you all for the great discussions, for attending tonight. You're not alone. And reach out to either Claire or myself if you've got any follow-up questions. We are here to help. Thanks, everyone.
Yeah, thank you.